Dr. Peter Glidden, your steadfast advocate for health. If there's one thing that I learned from my time at Landmark Education, so many years ago, it's that you don't know what you don't know. That's the way that it is for everybody. There's the stuff we know and the stuff that we don't know, and then there's the stuff that's so far outside of our reference range. Man, I didn't even know I didn't know that. And when you have access to that information, you have a eureka experience, which is remarkable. Well, I'm here to tell you that everybody in this country needs to have a eureka experience concerning the coronavirus and its treatment and its death rate, its virulence and its nastiness. Everybody needs to snap out of it, for goodness sakes, and take a listen from the naturopaths, and that would be me. Dr. Peter Glidden. I'm a licensed and regulated naturopathic physician. I have 31 years of clinical experience helping people to recover their health with the use of science-based, clinically verified naturopathic medical therapeutics. And I'm here to tell you that the people who are suffering the most from the coronavirus, the people who are putting the biggest burden on our wonderful healthcare workers around the world and hospital personnel around the world, are people that are sick. And who in this country is sick? Everybody in this country is sick. The rates are alarming. Heart disease goes up. Arthritis goes up. Autism, don't even get me started. Alzheimer's, it's the next epidemic. These illnesses are all going up and up and up. And oh, by the way, our life expectancy is getting shorter. And why is this happening? Well, I'll tell you why it's happening. It's not because of cell phone radiation, which is a real stress. It's not because of chemtrails, which are a real thing. It's because we haven't had a free medical market for 100 years. And the part of the medical hierarchy that's been in charge of everything is ill-suited to help people recover from chronic disease. The MDs, bless their hearts, are really great for trauma care, surgery when it's indicated. That's their thing, right? And they're really, really good at it. And that's where all the advances in the last 100 years have been in the field of medicine, is in improved surgical techniques, improved diagnostic techniques. But as far as coming up with treatments to eliminate disease, to cure people, the medical doctors, bless their hearts, they don't even know how to cure heartburn. They can manage it. They can't get on the other side of high blood pressure or arthritis or obesity or type 2 diabetes. They can manage it. So while people are under their care, their health gets a little bit less every year because the drugs have an effect on the body. And, thank God for Novocaine, right? Thank God for general anesthesia and the sterile technique. I'm not downplaying any of that, and many people may be surprised to understand that licensed naturopathic doctors in the U.S. can prescribe drugs. Isn't that interesting? It's not the drug, it's how it's used. So, since 1912 in the United States, we haven't had a free medical market. In 1912, under the influence of the Carnegies and the Rockefellers, the American Medical Association was granted exclusive control over who could and who couldn't practice medicine. It was a hostile takeover of the medical marketplace, and they kicked everybody else off the bus. Chiropractors were kicked off, the naturopaths were kicked off, the homeopaths, the herbalists, osteopaths, everybody was kicked off. And the MDs have maintained their position at the top with the unbelievable power and political persuasion of the pharmaceutical industry, which owns the world, by the way. So while we have been under their care, your health is getting worse. 1/3 of this country is overweight. That's adults and children. I know I'm wrong. Obese, not just overweight, obese. And you talk to anybody in a hospital that's overwhelmed with the coronavirus, with the COVID-19 illness, the people that are putting the biggest burden on the system are those that are obese and that are suffering with type 2 diabetes. And then there's those with upper respiratory tract conditions, which, either by the way that you count the numbers, are either the third or the fourth leading cause of death in the United States. Which means that, and here's your aha moment, here's your eureka moment, here's what you didn't know you didn't know. MD-directed, pharmaceutical-centrist medical treatment is horrible at helping people get healthy. It is. It's horrible at helping people get healthy. So people don't get healthy under the care of MDs, and then a viral stress comes along and it overwhelms their system. It's not their fault. It's the medical system's fault. But there is so much hubris and arrogance and pig-headedness built into the conventional medical system that it's like the Titanic. It's going to take decades for that baby to turn around. So I'm telling you, ladies and gentlemen, the best kept secret for healthcare in the 21st century is licensed and regulated naturopathic medicine. And you probably don't even know how to pronounce naturopathy, let alone what naturopathic doctors can do. You don't. And you should. And when you receive that data download, when you become privy to that knowledge base, everything will change. Everything will change when you understand what naturopathic doctors are, what their training is like, what their licensing is like, and what they can do. It's a game changer. Now, to give you a little bit of enlightenment along those lines, I've interviewed some of the leading naturopathic doctors in the United States of America and a leading medical nutrition researcher and put it together in a video on demand to help shine a light on what naturopathic medicine can do. Check it out. It will perhaps make a difference for you and bring you into the light of the type of medicine, licensed and regulated, by the way, that attempts to bring patients into a state of health. I mean, and all things being equal, which would you rather do in your life? Would you rather go to a licensed physician who attempted to get you healthy with science-based, clinically verified treatments, or would you like to go to a licensed physician who gave you drugs to manage symptoms and sweep things under the rug? Which would you rather do? See my point? Rise up into health right now, ladies and gentlemen. It's time. I am and always will be your steadfast advocate for health, Dr. Peter Glidden. God willing, and the creek don't rise. I'll see you around campus.